So far, yeah.
All right, I'd like to call the Human Services Committee meeting to order. Please, it's 3:30. Please remember that the meeting is being transmitted live via video. And the public can find a link to this video stream by visiting the Orange County website, www.orangecountygov.com. Click on the tab for legislature and can locate the meeting there. If I could ask everybody to please remember to silence your cell phones and tablets and any other electronic devices, I'd appreciate it. And also, please keep in mind that the microphones are very sensitive. Okay, please stand for the Pledge of Allegiance.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Doreen, could you do roll call, please?
Emo, Nagustakis,
Present.
Ellers,
Here.
Luhan,
Present.
Hotel. Here. Tui,
Here.
Sutherland.
Here.
Present, one absent.
Thank you. Okay, I'd like to invite Commissioner Miller up, Commissioner of Social Services. Thank you for being here today. Okay, so to start off, we have first on the agenda is a request to reallocate the position of Supervisor of Administration Support Services, grade 14, position number 31187 to grade 15. The funding for the salary change of $4,969 will be absorbed within the department's existing operating budget. Legislative request 121.
So moved.
Second.
Legislator Lujan, Legislator Hotel. Okay, Commissioner.
Thank you for your consideration. I want to thank Human Resources for completing a desk audit at the request of our staff. This position's responsibility have expanded over the years, as have many of our positions. And we appreciate their support of increasing to grade 15 and hope to gain your support as well.
Okay, does anybody have any questions? Thoughts? Okay, all in favor? Aye. Opposed? Okay, there. Okay, and then B, we have a request additional $12,576.14 to the intermunicipal agreement between the County of Orange and the New York State Police to cover additional expenses claimed for contract period ending March 31st, 2022. Funds are to be covered by existing budget. Legislative request 113.
So moved.
Second.
Tui and Hotel, thank you.
So as you know, the state police partner with us, work together in our child advocacy center. They're part of our multidisciplinary team and lead investigations of serious child abuse, sexual abuse and or physical abuse and fatalities. And they have been very active. So this is additional cost for that service.
Anybody have any thoughts or questions? Yes, Legislator.
Are they going out on calls with our social workers?
Correct, yes.
Thanks.
Okay.
I'd like to request to be added, please.
I'm sorry.
I have a request to be added.
Yes, if you could let your minority leader know, that would be great. Anybody else? No? Okay, all in favor?
Aye.
Aye. Opposed? Okay, motion carries. Commissioner, I know that your report also falls under mental health, like we just discussed a little bit, but I was hoping you might be able to give us a brief update on the opioid settlement and where you're at with that.
Yes, certainly. First of all, I want to thank the county attorney's office and first of all, the county executive who requested the county attorney's office to sue for these funds and also for their assistance as we begin to plan for these funds. They've been very helpful. Pierce happens to be in the room. And she's been very helpful to help us understand the settlement funds, to get a sense of how we should expect those funds to come into the county and what the limits are around how we can spend them and what we can spend them on. So just to say that we believe that before the end of this year, Orange County will receive somewhere around $4 million. That $4 million is one-time funding that can be spent over any number of years as long as it's spent on approved uses, which is very exciting for us. Grant funds that come in that way, they all have to be spent within a very specific time frame. And one-time use of funds is not as helpful as ongoing funds. So that is a positive. Some of the funds will pay out over 6 years, an additional annual stipend, and then others will pay out over 18 years, an additional stipend. So we put together a committee at the request of the county executive and have members, appropriate members from county government. Legislator Sutherland is joining the committee and will be representing the legislature on the committee at our next meeting. We have about 35 members on the committee, so they're human service providers, they're people who have used services and are in stages of recovery. They are parent advocates and supporters, and it's really, our first meeting was very productive in discussion. We reviewed federal standards for what is believed to be best practice for how you can reduce overdose fatalities. We've looked at the state best practice models, and we have developed our own from 10 years of focusing on this effort. We're all consistent, and in our first meeting, the members of the committee who shared quite frankly what their thoughts were also consistent with what we believe needs to be moved forward. So just to give you some generals of where the focuses are, focus is on prevention. If you don't pick up, you don't have to go through recovery. Second is on best practice, which is medication-assisted treatment, and being sure that people have access to treatment at whatever level matches their need, and access to medication-assisted treatment. That's Vivitrol, methadone, and or Suboxone, correct. And thirdly is safe prescribing. So really looking at how medications are being prescribed still today. I won't give any examples because I don't want to insult any credentials, but messaging really needs to go out to ensure that opioids are being prescribed safely and following federal guidelines on how they're being prescribed, so that, again, people don't begin this addiction all over again. And then access to recovery services across the continuum. The guidelines that have been put forward for how you can use these funds. There's restricted and unrestricted. The county executive has given us full access to the funds as a committee to make recommendations for how we put services on the street to help save lives. So it's not about paying past bills, it's about looking forward and how we can support people going forward to save them lives. So we appreciate that, and we take it very seriously. The next meeting, which is scheduled for July 20th, we'll be really targeting on prioritizing so that we can begin to develop RFPs and get them out into the community and start to get some of these services on the streets.
Legislator Anagnostakis.
Thank you. Darcy, thank you very much for your efforts in this area. I would assume, I don't know, but I would assume during the pandemic that the cases have risen. Is that true? And what's the trend on the addiction cases?
Correct. So using the medical examiner's office data, we had 121 deaths in 2020 from overdose due to opioids
How many did we
specifically.
have in 2019?
2019, let me try that, we can pull it up. Say 102, I have it,
Okay.
why I have to pull it up? Oh, I didn't have my phone with me. But anyhow, let me just say 121 in 2020 and 131 in 21. So we increased by 10, and believe me, we've done a lot of work.
And if it
to
was
try to
around,
prevent those
if it was around
increases.
102 or something that you were thinking, that's a big
Yes.
increase to 20, that's a
Correct.
30% increase.
Yes, across the state, across the nation, we've seen those increases. And so really spending a lot of attention around getting those numbers back down. Just so you know, we also are in a active phase of the Healing Community Study, which is a federal grant that Columbia received. So they also, at the same time that we're planning for these settlement funds, they are in our county for the next year and a half. I think we're going to get about $750,000 from that grant project, which is a research-focused project, looking at exactly the same issue we are, which is reducing the opioid-related fatalities. So
And I heard you correctly, the settlement fund was a one-shot, 4 million? For some reason, in the back of my head, I thought it was gonna be multiple years.
There are multiple years. So there are multiple years that we'll receive the funding, and this, I have a flow chart that explains those years, and I don't mind sharing that. It's really
And
not
so how
a
many years
secret.
does that chart go out to, and what's the total
This chart
amount
goes
of-
out to 2038.
And how much total dollars?
Gosh, I don't know if we have a total dollars on here. Just let me see. Before this goes out though, Lacey Trimble, our Deputy Commissioner in Mental Health, put this chart together. She did a fabulous job of going through very complicated funding. But we haven't had this approved yet by finance. They're looking at it as well, just to be sure that we have these numbers correct. But it looks like the total we'll receive for 2022 is 4 million. And then we'll receive in the subsequent years going forward, an unrestricted amount somewhere between 125,000 and 155,000 through 2038. And then an additional payment of 832,000. It goes up as high as $1 million at some point. So it's pretty complicated just to report out without you looking at it.
Okay.
So let us get it confirmed,
Okay, no,
and then we can
I think
share.
that's probably
Yeah,
the
that's,
best.
that's,
Yeah.
the 4 million is a good start point, and we know more money will trickle in over
Right.
time to supplement hopefully whatever your best
So
program is.
you plan for ongoing, and then exactly you pick out what do you need that needs to be funded over that length of time in order to keep people connected to service.
Thank you.
I also know that during the opioid committee meetings, which we had quarterly, some of those questions that you just asked, as far as numbers and whatnot, are all in there. So if you go back and check your emails, I'm sure you'll find the answers. Legislator Tatel, you have
That
a
was,
question?
thank you, that was my question, what was the breakdown between the 6 and the 18-year payout? So, hold for that.
Yes, yeah, we should have it more complete very soon. We just had a recent discussion, and Carol was able to connect with state reps that said there's no restriction on when it gets paid. And we thought other counties might have received their funding already, but we think they're just planning as we are, because we've only received $48,000 so far out of 4 million anticipated this year.
And on a separate note, I want to personally and publicly thank the commissioner for coming to a nonprofit in one of the communities I represent that has a small grant from the district attorney to do outreach for mental health, alcohol, and drug abuse. And she was a font of valuable information, and we're looking to go forward with that and with a few other of the nonprofits that you had mentioned. So I want to thank her for being there and working with us on this.
Yeah, we don't, physically isolated communities feel that they're not connected, and then when they don't have services right in the community, we want to be sure that we're bringing them to the front doors of the people who need them. So we have a planning process in place that will hopefully bring some more support to that community. Thank you very much.
Legislator Levin?
Thank you, Madam Chair. First, a question, and then, so the question was, has the committee had an opportunity to identify some of the areas of concern, like barriers, when we talk about the population that we're working with, what are the things that we've identified as biggest issues to, like, we've talked about prevention, that I get, but I mean, like, to connect them to services, what are some of the roadblocks? What are the clients themselves missing, when they get released from jail, for example, like, what are those identifiable, variables that we could be doing better to help them get on a pathway to wellness?
Yes,
And then
that,
the comment.
those were some of that was some of the discussion that came up there, certainly. And once you get to the front door of the service, what's your experience once you arrive there? Because that's going to make a difference of whether you walk through or not. So that was discussed as well. We've also had some very in-depth conversation, need to have more with like ADAC, for example. We've had some good community forums and some student forums to really understand what they believe will help them and prevent them from picking up and using substance or going further down the use or addiction path. So that is invaluable to planning for how we support those in the community.
So like peer surveys. Okay, that's excellent, because I'm a big supporter of that, making sure that we're reaching out to people, seeing what has worked for them in the past versus what hasn't. My big concern, I'm a medical assistant treatment coordinator in Dutchess County. So I see this every single day. One of the biggest things that I've seen in Dutchess, as I've seen it in Orange, is that, and you and I have talked about housing as an issue for years, but housing, when it comes to that particular population, has been one of the most devastating things I've witnessed. Seeing a person who is struggling with their addiction, and then also forced to be homeless because they might not qualify for certain programs, or because, maybe they, previously, before going to jail, they might have, might not necessarily follow their plan. Or they might not receive enough money to get a room or to get an apartment, which makes it harder for them to get on their path of wellness because you don't have a place to live. Are you really gonna be thinking about going to treatment? Are you really gonna be thinking of a treatment if you don't know if you're gonna have running water? No, it's not it. So this is a base foundational concept. So this long-winded comment only is to say, I really hope, and I'm sure it probably is very much part of it, that the housing piece for people who are struggling with addiction should be very much at the forefront of that, because what I see, the biggest issue that I've seen with our community members that are struggling with addiction, people I work with every day, is many of them on the street, and it continues. And it's been it's heartbreaking to see, that the moment that you have a case manager who's working with a client and you can't help them with housing, that person might not want to work with a case manager anymore, because you've already shown that you can't move heaven and earth to get them what they should be able to get.
Yes, agreed, yes.
I
One
think
of the-
everybody will agree with you that
one of the
housing,
top priorities.
affordable housing is an issue.
One of the top priorities.
Excellent. I'm
Would
happy
you
to
say
hear
it to them?
Thank you, Chairwoman.
Yeah.
Darcy, my understanding was that when it was first coming out about the settlements, was that it could be anywhere from 4 to 7 to 8 million. Now, is this 4 million just from a certain pharmaceutical companies that have settled? And are there more pharmaceutical companies that are still dealing with lawsuit?
It's from all of the pharmaceutical companies that have settled, so it includes Endo, Janssen, and Allergan.
And are there others?
I don't believe there are others,
I
correct?
believe there were 4 settlements, Endo, Janssen, Allergen, and then the big distributors, they called it. So the four litigations.
Oh, yeah, distributor settlement, I apologize, yes.
So
that's
there were
what I'm
4, and then they've all trickled. Some of the settlements are coming in 16-year terms, some are 18, some are one-time payments. And so and then we get percentages from New York State. So there's huge formulas with each one of the settlements.
So this is gonna be a larger number that we end up getting at the end of the day. And
At the
How
end
many
of the
years?
18 years, right,
18
it's
years.
going to be a much larger number as a total. And we may be able to estimate the total too, as finance takes a look at all of these settlements and it confirms the formulas that we believe have been included in this document that we're working off from.
And then with the distributors, that was one of 4 entities. And do we know how much, did they settle yet? The entities, the distributors too? So there's
They've
4
all
that.
settled, they're getting some of the documents are done, and some of the lawsuits, they're just doing the paperwork, and that's why we're getting the numbers trickled down from them.
And are there any more lawsuits coming down the road for different pharmaceuticals?
Right now, not that I'm aware of.
And at the same time that this is happening for us, the state is putting out RFPs too, with some creative planning to try to fill the gaps. So, there's a lot of opportunity to bring expanded service in. Just have to work as hard as we can to ensure that that service is what's going to meet the needs. Just putting more money into something that isn't helping is not the direction any of us want to go. And I think the state has some really good ideas in the RFPs they put out, like mobile medications as a treatment, for example.
Good.
And I do communicate with Commissioner Duchess, so I already know what she put out in her RFPs too.
Well, thank you. So anything else, any other questions?
One quick one, if I may. We're talking about the population that we're serving, and I'm wondering, is it a defined population? Does it cut across classes and races, and is it a specific geography in the county, or is it everywhere? I would assume it would be everywhere regardless. Am I right or wrong?
It's everywhere, and I think you've seen OD mapping, that we have some of the overdoses, both fatal and non-fatal, are mapped, and you can see that in the cities and the surrounding areas, we have larger numbers, but it's across the entire county that you see the overdoses, the fatality, you see the use happening. And when we talk about prevention, that is also, the entire county population when we talk about prevention efforts that are needed. So these funds will touch as many lives as we can get them to touch.
And under prevention, I'm sure comes awareness with marketing and
And
advertising.
again, though, that just to say that this, with the healing communities coming in, they've already worked in 8 counties. Now they're in the second 8 counties, and we're one of the second 8 counties. They have a marketing plan that was already established as best practice in the other counties. We get to use those ideas.
Yeah.
And forward those, move those forward
They
too.
don't have any results yet from those campaigns.
They do, but because it's a research project, they only share limited results, but they will guide
At the
us.
study.
At the end of the study, they're sharing everything correct, yes.
Thanks, Jim.
All right, great, thank you. Would you like to go to the monthly report? Thank you.
So our monthly reports. We see a little bit of an increase in our safety net. We expect to see increases, as we've talked about, in family assistance and in safety net. We're beginning to see a small increase in safety net. That's for singles who need cash assistance and support. We're still struggling with unemployment. Not unemployment, we're struggling with not having enough employees to fill the job needs across Orange County, I think across the country. At the end of the day, we expect to see our numbers increase for cash assistance and support. SNAP numbers are going up, and they'll continue to go up as costs rise, as people stay out of the workforce, and we're available to process those applications. Just in case you get calls, we're currently discovered that there's some issue, potential fraud with EBT cards, which is where people get their benefits. We've had over 20 calls in the last 3 days of people whose money was stolen from their benefit card. We're currently reported to the state. We've had counties surrounding us confirm they're having the same issue. And we send it through our Public Welfare Association to get a sense across the state from other commissioners what's happening. We hope to get some kind of response from the state to give us some guidance in what's happening and how to address this issue. But the benefits have been used in Texas and Ohio, and our people have not left the county. So it's very concerning, and we don't know how bad it's going to get before we figure out what's happening. So, and it's not us that has control to do something about it. It's really with state assistance. So you may start getting those calls, as our consumers are very upset, as you can imagine. We talked about the last time we were here, the heat benefit and how much of that heat benefit was arrears. So I appreciate Todd, who's not here with us today because he's actively working on our budget. He's desperately working on our budget. That's right. So I said, don't come over. We'll be fine without you for today. And so we gave out 19,222 benefits, and of them, 53.6% account for the arrears benefit, which is $6,269,379. This amount also includes approximately 20% of this amount, so a little over $1 million would be their current benefit. But the rest of it was the arrears, the up to 10,000 for those who had arrears for utilities. So that's a significant amount that went out into Orange County to pay arrears utility benefits. So I promised you that number, and that is the number.
Chairwoman?
I'm sorry, yes.
Commissioner, with regard to the upcoming cold weather, I don't want to put a jinx on our hot summer here, but we know it's coming quick. And is there any talk about, is this going to upset budgets where we get our money from the state or the federal or wherever that, or will they continue to add to it? And how do you set like a ceiling on it, or the ceiling is getting tight that if it doesn't get any better in the fall and the winter,
You mean the cost?
the cost of fuel for the individual homeowners?
Yes.
I think that they'll, if I heard correctly, I think they'll fill you up in the beginning of the season. And then, you kind of have a cap, they'll pay that, but now with it going through the roof, how do you foresee that to play out?
Well, there's a cap on the total benefit amount.
Or,
From the, so that for the state, the feds get the money to the state has a cap on the total amount. So once they reach that total amount, they pull the benefit back or they find more money. Is what happens with the heat benefit. So to people who apply for a benefit, they'll get their benefit at whatever the market rate. And once that cap of the total amount is
Is
reached,
that total?
the state would pull it back.
Individual or per household?
No, it's a total cap overall.
Okay.
Yeah. It's
So
not
if things
for
don't
household.
get better. they have to
Less,
find
less
more money.
people, right.
They're gonna have to find more
They
money.
go to find more money, there's a, you get your initial benefit, and then they determine based on how much money's left in that pool of money, and they'll offer a second benefit, and then there's always the emergency benefit going forward. So I can't predict how the state will respond, I would imagine they want to continue to help at the same level that they've helped previous years, but
So we
eventually the
have
money
some
might
levels
run
like that,
out.
we have the initial benefit, the supplemental. And I would imagine that that's budgeted for that, but the third one that you were saying, that
Well,
would be
there's a-
emergency.
There's an emergency
And
benefit,
is that budgeted too?
correct,
It is.
it's
all.
all part of that cap, yes.
So it's part of the
It's
cap,
total.
so the supplemental is still in the cap.
Correct.
So what if all three are exhausted, then that's where they have to find more money.
Correct.
Okay.
Or not offer more benefit, and then that would be a challenge.
That would be a big struggle for the recipients that we have now.
Yeah, I'm sure there's discussion happening. We have Public Welfare Association meeting coming in the end of July, and I'm sure all of that will be part of the conversation we'll have there too. How we're planning to support people. I will, absolutely.
Thank you.
Sure.
Thank you, Chairman.
Okay. Emergency housing placements, we're going back up to pre-pandemic numbers for housing of our homeless across all of our service areas. The renovation at Honor is about 50% done. Irene, our deputy in social services, has been the lead on that project, and they're really working right along. I believe this is the same number we reported, no, 129,181 residents receiving Medicaid. That has been extended, maybe I said this last meeting, extended through October on the waiver, so there will be no closures in Medicaid cases or recertification, at least until the end of October of this year. Our child welfare staff have had a rough month. I just bring this up here to go on record and just for you all to be ambassadors of the message regarding co-sleeping. You know, the State Office of Children and Family Services sends this message out. You may not be aware, but every year a child dies in Orange County connected to co-sleeping, an infant, I should say. You have children and grandchildren and nieces and nephews and friends, please do not co-sleep with your babies.
You said co-sleeping, correct?
Co-sleeping, correct.
Family bed.
Yeah.
Yes, co-sleeping. Yes, it's dangerous for a child who can't move, and you know, we all have vested intentions, and I brought my little ones in. If I knew it then what I know now, I would not have co-slept. So just to put that message out to keep babies safe. Okay, Orange County raised the age numbers. We do see a little bit of an increase. I think managing well with those numbers. I participated in one of the cross systems meetings that we talk about here, and it was very impressive to have our Department of Social Services, Mental Health, Probation with the school district really brainstorming best practice and doing a great job of putting plans in place to try to keep youth in the community, to keep them crime-free and our community safe while their needs were getting met at the same time. So really, really good work. Did I miss a protective? Foster care slowly going up. Our numbers are slowly going back up. You know, we expected that at the end of the pandemic that we'd see an increase in calls that would go in, increase in children coming in care, but they're slowly going up, and our staff are doing a fabulous job with supporting the children in care, working to get them into permanency within 18 months. Adult protective, I said the last meeting, I would share with you anything that went out around elder abuse prevention. And this flyer is almost done. I was gonna forward it to you, but it needed two edits. So I will send it to you hopefully before the end of the week so that you can share it on your social media sites also. I'm just acknowledging that, 5 million elders are abused every year. And there are signs and symptoms to look for in loved ones who may be being abused and the phone numbers to call. Child support. Doing a fabulous job collecting, they pull in $42 million a year typically in child support. That's helping to keep children safe. Our feds unit active, back out into the community. Just ensuring that people are receiving their benefits appropriately and reporting to us accurately.
Is there any questions? No? Okay, well, thank you so much, as always, for your in-depth reports and, just being such a wealth of knowledge to all of us. This is our questions and whatnot. Thank you for being here. Thank you. A motion to adjourn.
So. Second.
Second.
Okay. All in favor?
Aye.
Okay.